continuing our series on the importance of seeking medical care during the pandemic. And today we're focusing on mammograms. We're joined by Diane Kush, mammography technologist and operations manager at Rochester Regional Health. Good morning. How are you?
Good morning.
That's a heck of a title, by the way. I like it. You know, mammograms we talk about a lot as far as preventative care, but you can't get preventative care unless you go in to do it, correct? And I know a lot of people right now are nervous about going to the doctor for anything, you know, unnecessary, anything they think, you know, they could catch COVID from. But we've been wanting to do this series to make sure that people know that it is safe and that you do still need to go in to get these mammograms. So how many people are you seeing coming in for this still? And do you feel like people may be avoiding it right now?
So we are seeing patients that are coming in, more so now. When the pandemic came in March, we ended up stop offering screening mammograms. So, you know, we had a lot of patients that were rescheduled and canceled. And when we started calling those patients back, when we resumed doing the mammograms on site, we ended up getting a lot of patients who were fearful and expressing concern about their mammogram and not wanting to come in, and the environment around COVID. And so we have gotten a lot more patients to come in. I think, you know, the Finger Lakes region, as we started to open up and we started to have other facilities and businesses and stuff, I think that people ended up feeling a little bit more comfortable. So we're starting to see more patients, but it is one of those areas that we're not seeing as many patients as we normally would.
Right. And Diane, just so we can kind of go back to basics, at what age do you recommend that women get a mammogram, and how often do you recommend that they get one as well?
Yeah, so mammograms should be done any woman age 40 and over. Now we're talking about just screening mammograms, asymptomatic. So 40 and over, and they should be done annually. Imaging, our recommendation follows the American Society, the ACR recommendations, American College of Radiology, and that is for annual mammograms.
And Diane, is that something that you recommend women schedule along with their yearly gynecological appointment? Is it something you suggest doing separately? I know that's something, you know, you don't really think about all that often until, oh gosh, it's that 1 year appointment, I need to get that done.
Yeah, I mean, if women can fit in both at the same time, more power to them to be able to do both. They're both needed exams, the pap smears and the mammograms are both annual exams. We have a lot of flexibility. A lot of our offices at Rochester General have other practitioners in the building. So to make that appointment at the same time as their mammogram can really be convenient for them.
Yeah, now if only you could get your teeth cleaned while you're there, you can get all those appointments knocked out at once, right? Get your taxes done. Diane, I know with scheduling these kind of things, you often book out, right? So whenever you go to OBGYN's office, like, oh, we can get you in 6 months from now, it's usually something you have to book so far in advance. Are you able to reschedule all those appointments that had been delayed when the pandemic shut everything down that wasn't essential?
Yeah, we do have room in our appointments. We have 7 different locations that offer mammograms scattered throughout Rochester. So we offer evening appointments. We offer Saturday appointments, you know, as early as 7:30 in the morning to try to accommodate all patients' schedules.
Yeah, that's fantastic. Sounds like a lot of opportunities to get in. Over 40 if you're asymptomatic, once a year. Diane, thank you so much for those reminders. It's always a good idea to keep that top of mind, especially as we make our appointments heading forward. Thank you so much.
Thank you for your time.